And thank you for taking the time to watch my presentation. Today I'll be discussing how current drug policies contribute to the mass incarceration crisis in the United States and how an alternative approach can help address these challenges. Through this presentation, I'll outline the scope of the problem, share real-world examples, examine ethical concerns, and propose potential solutions to this pressing issue. So let's begin. Mass incarceration in the United States is a significant social and economic problem, and drug policies play a major role in fueling it. Over 450,000 people are currently incarcerated for drug-related offenses. Many of these cases involve simple possessions rather than violent crimes. What's even more troubling is the racial disparity in enforcement. Black Americans are nearly 4 times more likely to be arrested for marijuana possession than white Americans, even though both groups use marijuana at similar rates. This approach isn't just socially damaging, it's economically unsustainable. Since the 1980s, the war on drugs has cost over $1 trillion. Billions of dollars are spent each year enforcing laws related to marijuana alone, diverting resources from critical areas like education and healthcare. It's clear that the criminalization of drugs has done little to solve the issue of substance abuse while disproportionately harming vulnerable communities. This brings us to the central ethical dilemma. Should drug use be criminalized, or should it be addressed as a public health issue requiring medical and societal intervention? On one side, proponents of criminalization argue that punitive measures deter drug use and uphold social order. However, evidence shows that this approach leads to the long-term harm, including cycles of poverty, family separation, and barriers to employment for those with drug convictions. On the other side, treating drug use as a public health issue emphasizes harm reduction and rehabilitation. This perspective views addiction as a medical condition rather than a moral failing, shifting the focus from punishment to prevention and recovery. The ethical question here is whether we value retribution more than we value equity, health, and justice. To illustrate the human cost of punitive drug policies, let me share the story of Jonathan Magby. Jonathan was a quadriplegic who used marijuana to manage pain from a spinal cord injury. In 2004, he was arrested for possessing a single marijuana cigarette in Washington, D.C., and sentenced to 10 days in jail. Despite his severe medical needs, the jail lacked the resources to take care for him properly. Tragically, Jonathan died while serving his sentence. His story highlights the ethical failures of a system that criminalizes drug use without considering individual circumstances or health needs. Cases like his underscore the urgent need for reforms. To address the harms of current drug policies, I propose the following solutions: decriminalization, public health programs, and rehabilitation over punishment. These policies prioritize compassion, evidence-based practices, and justice while addressing the root causes of substance abuse. Critics often argue that decriminalization will lead to increased drug use. However, data from Portugal shows no significant rise in drug use after decriminalization, but a sharp decrease in drug-related deaths and disease transmission. Another concern is public safety, but legalizing and regulating substances can reduce the dangers of the illicit drug market, ensuring safer consumption and fewer criminal networks. Finally, some believe punishment is necessary to deter drug use. However, research does consistently show that punitive approaches fail to address the root causes of addiction, which are often tied to mental health and socioeconomic factors. A public health approach is both more effective and more humane. Now, let's talk about the expected outcomes if drug policies were reformed to focus on public health instead of criminalization. First, we'd see a significant reduction in incarceration rates. By decriminalizing or legalizing certain drugs, fewer people would be arrested and jailed for nonviolent offenses. This would alleviate overcrowding in prisons and save billions of taxpayer dollars currently spent on incarceration. Second, public health outcomes would improve. Harm reduction programs, such as accessible treatment centers and overdose prevention initiatives, would lower the rates of drug-related deaths and diseases like HIV. Portugal's experience with decriminalization is a clear example, where overdose deaths dropped significantly after their policy changes. Third, the economy would benefit. Instead of spending resources on enforcement, we would invest in education and healthcare. States that have legalized marijuana, such as Colorado, have generated millions in tax revenue and created jobs in the legal cannabis industry. Fourth, we'd see improvements in social equity. Expunging criminal records for minor drug offenses would give people a second chance, removing barriers to employment, housing, and education. Finally, by regulating the drug market, we could weaken the influence of criminal organizations, making drug use safer and reducing the violence associated with illicit drug trade. In summary, all these outcomes show that treating drug use as a public health issue is not just ethical, it's practical and beneficial for individuals and society alike. In conclusion, it's clear that our current approach to drug use and criminalizing it has fueled mass incarceration, exacerbated racial disparities, and placed a significant strain on our society. By shifting to a public health-centered approach, we can achieve better outcomes, reducing incarceration rates, improving public health, saving money, and creating opportunities for those affected by outdated drug laws. This is not just about changing laws. It's about creating a more equitable and compassionate society where addiction is treated as a health issue and not a crime. Here is my bibliography, or my reference list. I thank you for taking the time to listen, and I hope this presentation sheds light on why performing drug policies is an ethical and practical necessity. I'm happy to answer any questions you may have.